Hi, everyone. This is Mackenzie Bean, Managing Editor with Becker's Healthcare. Thanks for joining us for this podcast. Today, we're so thrilled to be joined by Dr. Cole Edmonson, who is the Chief Clinical Officer of AMN Healthcare. Dr. Edmonson, thank you so much for being here today. How are you doing?
Thank you, Mackenzie. I am doing well. It's an honor to be here with you today. And thank you and Becker's Healthcare for highlighting such an important topic in healthcare today.
Of course. I know we have a great conversation queued up on nurses' mental health, but before we dive into that, I'd love to have you share a little bit more about yourself.
Well, thank you. And it's really an honor to be here again and to be able to share a little bit about what we do at AMN Healthcare. But about me, I had been in nursing for about 30 years. I have had different levels of positions and opportunities to really lean into healthcare, both in hospitals and healthcare systems, and now in the total talent solutions industry as well, to be able to help bring some of those complex solutions to some of the complex problems that we actually have in healthcare. I've spent about 18 years being a chief nursing officer in different healthcare systems, both in Oklahoma and Texas. And I'm really thrilled to be able to talk about something that I care so much about today, which is really establishing and keeping our nursing workforce well.
Which, as you mentioned, is such a crucial topic, especially right now, considering the past 2+ years that nurses have gone through during the pandemic. And I know AMN has been doing some interesting research on the topic as part of working towards solutions. So can you tell us about the 2021 RN survey and what that entails?
I would love to share that. And, first, let me just say thank you all for taking the time to help highlight this issue again. This is an issue that's been facing our nation's nurses for many years, but really has really come to a crescendo for us in terms of the pandemic. And for me, the nation's nurses have cared for us time and time again, for our families and our friends across the country, both before the pandemic and during the pandemic, literally working tirelessly and at great risk to their own health and well-being. And we have to acknowledge their efforts, their commitment, their sacrifices. And we as a society are really indebted to these individuals in this profession. And we have to do everything we can to ensure that they're cared for as they've cared for us. And one thing I always like to share, Mackenzie, is that in any disaster scenario, there's what we call a fourth wave of mental health issues. And it's really building during the disaster because everyone is really focused on the immediate crisis situation. But that fourth wave typically peaks after the crisis is over. And it oftentimes has a very long tail on it with lasting impact. And we've seen some of the impact of the pandemic, but we don't know its full effects just yet on the entire healthcare workforce, especially our frontline caregivers, or what I call the first in line caregivers, and even our leaders in healthcare. So when we dove into the survey of registered nurses in 2021, it's a biennial survey that we undertake to really try to assess the most recent trends in the profession of nursing and in the lives of nurses. The responses to our 2021 survey of registered nurses were collected in May of 2021, and we received more than 6,500 survey responses by registered nurses in the U.S. that were actually caring for and practicing in the past year and providing direct patient care. One of the major facets of the survey focused on mental health and well-being of our country's nursing professionals. As members of the largest healthcare profession with the most direct patient contact, we know that nurses have suffered severe hardships from the pandemic. And the mental health ebook supplement that we produced from our survey provides an overview of this incredibly important issue and provides an overview of solutions to help better care for nurses who have been working in extremely difficult environments and under unprecedented stress to care for our communities. I also want to make a note here, Mackenzie, that healthcare environments are a micro reflection of the macro issues in society. So nurses are not only impacted by the pandemic, but also by racism and genderism and homophobia and sexism and by violence in the workplace against nurses that are happening from patients and visitors. All these larger societal issues really compound the extreme conditions that the pandemic has placed on an already burdened profession with healthcare shortages, pay inequities, respect issues, and even bullying that exist that was all pre-pandemic, but really exemplified even more in the pandemic. As a nurse, I've had my own experience with these issues. So I wanted our survey to go a little deeper and really understand the real issues that haven't been explored or really discussed so that we could understand the total nurses experience and start to solve for these. Even with all these negatives, though, Mackenzie, that impact our profession in healthcare, we found that 81% of nurses loved their profession. But it was most often the job structure, the environment, the burdensome documentation, regulations, and sometimes lack of resources that really created the dissatisfaction that gets in between the patient and the nurse and their duty.
Absolutely. It's great to see, there is still that love for the profession, but definitely the survey has identified some areas that need improvement to make the workplace a better place for nurses and really support their well-being. And I know you mentioned the overall effect of the pandemic on nurses who's really yet to be seen, but I want to talk about some of the immediate impacts that we have seen on registered nurses. How has the pandemic affected those who were either diagnosed with COVID-19 or who cared for patients during this time?
Look, the COVID-19 pandemic has created a tremendous impact on nurses, perhaps more than any event in modern history since World War II. The 2021 survey showed that 83% of the respondents in our survey had actually cared for patients with COVID-19, while 18% were themselves diagnosed with COVID-19. If we extrapolate that, that's approximately 720,000 nurses nationwide that would have contracted this virus. Nurses who cared for patients with COVID-19 were significantly affected by their experience. But nurses who had been diagnosed with COVID-19, for them, things were even worse. They were more likely to experience the negative health effects and the wellness impacts from their work, and to begin to worry even more about the risks that were associated with nursing. A higher percentage of these nurses felt emotionally drained, felt like resigning, and were less optimistic about the culture of nursing and their workplace. And nearly twice as many nurses diagnosed with COVID-19 say they may leave the nursing profession compared to nurses who were not diagnosed with COVID-19. Interestingly enough, we also found that nurses who cared for patients with COVID-19 also reported a greater desire to return to school and to get that next degree. So we have a lot to continue to learn and unpack from this survey, but these are some of the most immediate impacts that we're seeing on the nursing workforce.
Absolutely, and that 720,000 figure is pretty startling. Let's dive a little bit deeper into the effect on nurses' mental health and well-being. What are you seeing there? What steps can nurses take to address their mental health, and why is that focus on self-care so important right now?
The impact of COVID-19 pandemic on the mental health and overall well-being of nurses and other healthcare professionals really represents a critical challenge for the healthcare system. In the survey, we cited a number of other supporting surveys that illustrated the impacts of the hardships our nurses have endured. One study of ICU nurses found that 45% reported symptoms of moderate to severe depression, and 47% were at risk for post-traumatic stress disorder. And younger, less experienced nurses were more vulnerable to the mental health impacts from the pandemic. And that's really significant, Mackenzie, when you know that more than 50% of the workforce in nursing is now the millennial generation. So for the first time in history, the millennials are the largest generation of nurses in the workforce. And in another survey, we also cited that 82% of their respondents said they were suffering from emotional exhaustion, while 70% had trouble sleeping, and 63% were experiencing what we call work-related dread. These conditions are really harmful to the mental health and the well-being of nurses, but they can also represent patient safety issues as well. But there are a lot of steps that nurses and healthcare organizations have taken to try and help. As a former chief nursing officer myself, I can tell you that chief nursing officers are deeply committed to caring for caregivers, and they're dedicated to doing right by the caregivers and the patients because at their core, they are really nurses first. So approximately 46% of nurses we surveyed said that they engage in activities or access resources to address their mental health and well-being at least twice a week. And nearly 1/4 said that they do so at least 4 times a week. So that's very encouraging. But nearly 2 in 5 nurses have a post-shift ritual to transition from work to their personal lives. This is really an important point for us to consider building on as a profession, to help nurses transition from work to home and to provide a boundary for personal time and caring for themselves. Self-care is not selfish. In fact, it's quite the opposite. It's the most caring thing that we can do for others is to care for ourselves. However, we did find that 1/3 of the nurses don't take any steps to address their mental health and well-being, which is very concerning to me both as a leader and a nurse. Daily or really regular practices at the unit level can be very helpful, Mackenzie, in reducing stress on nurses. Nurses are participating in critical incident stress management programs, debriefing huddles, and even utilizing spiritual care resources to create what we call safe spaces. This can include great programs like the Schwartz Rounds, which are group reflective practice forums where nurses and other healthcare professionals can discuss unique emotional and social issues they face in caring for patients and families. It creates a safe space to unburden the caregiver. Additionally, it's really important for leaders to be present. Leader rounding with clinical staff has such a positive effect on mental health. Other purposeful practices that can be helpful to help manage and reduce the daily stress of nursing includes debriefing, team huddles, and peer support stress first aid programs. And I love that you ask about self-care, which is incredibly important. Nurses benefit when self-care is promoted across personal, organizational, and their professional lives. We cited a couple of studies in the survey showing that when nurse educators teach self-care and resilience to nursing students, it can be effective in helping them to reduce burnout and exhaustion and enhancing awareness of the importance of stress reduction and self-care. Self-care habits really need to start before you become a practicing nurse. They're also really important life skills, and we should be embedding them into our student education and student programs as early as possible.
I love what you said about self-care, not being selfish, and all of these strategies you've laid out are so helpful to hear. I think one other trend we're seeing more is employers providing employer-led programs to help support mental health. Can you talk about how these help and what kind of results you've seen from them?
Oh, absolutely. Most healthcare organizations provide nurses and other healthcare providers and coworkers with some type of mental health care resources. The most widely available support comes from employee assistance programs or EAPs. Again, in our survey, we cited some additional research that shows that utilization of employee assistance programs is low, and in part because of the persistent stigma of mental illness issues. But the high levels of promotion by organizations do result in a greater likelihood of coworkers and nurses and healthcare professionals utilizing these programs. One of the most powerful ways we can destigmatize these programs is to reframe them from employee assistance programs to team member success programs, and to tell our own stories as leaders, because we've all had times when we needed assistance. And simply put, it's about being vulnerable and sharing our own humanity with others. Nearly 2/3 of the nurses in our survey said that their healthcare organizations support a culture of wellness, at least at a moderate level. And 75% of nurses said these programs were effective, which is all great news. I do worry about the third of nurses in the survey who either worked in settings with limited or no wellness resources, or they were unaware of them. It's like most things in life, we need to continually message about the resources available to our team members and continually encourage them to use them. But destigmatizing the mental health illness and challenges that people face in healthcare and really reframing the EAP programs to a team member success program, for me, is one of the primary interventions that we can do early on to help people be successful in not only their work life, but their personal lives.
I think you're so right that healthcare organizations can play such a key role in destigmatizing mental health, which is so key and needed. I'm curious, what efforts has AMN Healthcare put into place for caring for caregivers?
Mackenzie, I'm so proud of what AMN Healthcare has done to care for caregivers. One area of rapid innovation during the pandemic for us was really taking our mobile technology for healthcare professionals and adapting that. We developed an app to help nurses manage all the business aspects of their work, while another supported clinical work, such as video conferencing and exchanging critical information with patients, their families, and their colleagues. We also adapted and really expanded support services to telehealth, especially mental health counseling. We provided free counseling on demand for caregivers and their family members through video conferencing. Their AMN clinical team, which is in regular contact with all of the healthcare professionals, were all trained in psychological first aid so that they could quickly spot potential problems and provide intervention. Sometimes what a clinician needs most is a safe space to connect with someone with shared experience, to just listen, be supportive, and sometimes gently guide them, which is what our clinical team does so beautifully at AMN, along with so many others at AMN who care deeply about our healthcare professionals. We also had the great opportunity to partner with Headspace, the most science-backed meditation app in the world. And we provided this to all our team members with a membership to utilize the strategies and the tools to help them relax, to focus, to have better sleep patterns, and to help reduce daily stress. And additionally, with NAMI, the National Alliance on Mental Illness, we entered into a stigma-free company partnership. NAMI provides us with their expertise and resources to help us really cultivate a culture supportive of mental health. But psychological counseling alone was not enough. So we offered other programs to help with life, such as free financial information and resources, and legal support and resources to help reduce the common stressors that may afflict all of us. Research has really shown that people that do random acts of kindness tend to be happier in their own lives. We applied that to our healthcare professionals by allowing clinicians that had worked a certain number of hours to designate where AMN would make a donation on their behalf. And I'm really proud to say that AMN donated over $1 million in the name of and with the guidance of caregivers to nonprofit organizations that were important to them last year. And additionally, another recent initiative we're rolling out really for our nurses and all of our healthcare professionals is Care for the Caregivers grant program. This program helps alleviate the stresses that come with life-changing events. Our grants, with awards of up to $5,000, are meant to help our caregivers and their families cope with expenses during life's setbacks. We partnered with the Dallas Foundation, a nonprofit 501c3 organization, who will help us manage this national program for our caregivers. As these are grants, nothing needs to be paid back. It's just another way we thought we could try to help and let caregivers know how much we appreciate what they do in supporting patients, families, and communities. And these are all acts of thankfulness and gratitude on behalf of AMN to all of our caregivers. And we wanted to make sure that we were taking care of them professionally, but also personally, because we all have such integrated lives.
Absolutely. That's so amazing to hear, and clearly a lot to be proud of, like you said. I think one thing I'm taking away from our discussion today is the need for collaboration. It's really going to take everyone's effort to provide mental health support for nurses. I'm curious, have there been any updates or progress on these efforts since your survey was done in 2021?
Yes, I'm glad to say, in fact, yes, there really has been. One of the primary advances is the Dr. Lorna Breen Healthcare Provider Protection Act, and it was passed by Congress and signed into law on March 18th in 2022. The bill, which received bipartisan support, was named after Dr. Lorna Breen, a physician working at New York Presbyterian Hospital in Manhattan, who took her own life after working around the clock for weeks to treat patients with COVID-19. And the new law will support healthcare workers' mental health and provides funding of up to $135 million in mental health education and awareness initiatives. These services really help to reduce stigma, provide training, and encourage healthcare professionals to seek care. As we've seen firsthand, many healthcare professionals are coping with their own trauma of losing patients and colleagues and fear for their own health and safety. So this bill will help promote mental and behavioral health among those working on the front lines of the pandemic and those who are first in line on the pandemic. It further supports kind of the burnout and suicide prevention training and healthcare professional training programs, which increases the awareness and education about suicide and mental health concerns among healthcare professionals. Additionally, AMN has worked with organizations to provide resiliency programs to nurse leaders, increase diversity in nurse researchers, implementing the Schwartz rounds I mentioned in underserved and rural hospitals. And we're also working with the National League for Nursing to help end racism in the educational system of nurses and to implement recognition programs in rural and international facilities with the DAISY Foundation. But with all that, Mackenzie, we know we can do more to support the nursing profession, and our commitment is that we will.
Absolutely. I think you're so right. It's important to talk about where we are at in the industry right now and what nurses need, and then continue to build on that because they deserve all of our support. So Dr. Edmonson, thank you so much for joining us on the podcast today. It's been such a pleasure speaking with you on what is such an important topic. I'd also like to thank our podcast sponsor, AMN Healthcare. Listeners, you can tune into more podcasts from Becker's Healthcare by visiting our podcast page at beckershospitalreview.com.